a.m. or on YouTube, channel 𝗛𝗲𝗁𝗁𝗶 8:10 a.m. Radio Bandido.
The views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole Jacinto. Join us on Healthline with 𝗏𝗏𝗵𝗏 as we discuss the latest health and medical topics with doctors from 𝗏𝗏𝗵𝗏. For a healthier and uplifting lifestyle, tune into Healthline with 𝗏𝗏𝗵𝗏 on 𝗛𝗲𝗁𝗁𝗁𝗁 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗏𝗏𝗵𝗏, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search 𝗛𝗲𝗁𝗁𝗁𝗁 Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗵𝗏 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
This week's show, we're going to talk about kidney issues. Now, we're going to talk with Dr. 𝗂𝗏𝗏𝗏𝗏 of Makati Medical Center. Of course, she is. Hi, doctor. How are you? Welcome to the show.
Hi. Hi. Good day, everyone.
You know, everyone, from the very short conversation I had with Dr. 𝗂𝗏𝗏𝗏 just now, right before we began the show, I can tell she's going to be very articulate and very informative. And that's true, Doc. Boom. She was like, you know,
I hope so.
you are going to be, I can tell. And that's the kind of doctor that we like on this show, especially. And that's the kind of doctor that everyone likes for, when they seek their own treatment or treatment for people that they care about. So I'll probably seek you out, doctor. I'll probably get your number after the show. Okay, great. Recommending people, recommending doctors to people and telling them where to go. And of course, you're yet another asset that Makati Medical Center has on its roster. Okay, so it's Dr. 𝗂𝗏𝗏𝗏𝗏, nephrology specialist. And let's start by talking about so we're going to talk about kidneys, of course, because that's the specialty of nephrologists, right, doctor? So can you tell us first, what exactly are the kidneys' function in the body?
Well, the kidneys have different functions besides making urine to avoid overflow of fluids in our body. It also detoxifies our blood. So in layman's term, it cleans our blood. And these are the top two things that our kidneys do. But it also regulates our hormones, our electrolytes, our calcium, our phosphorus, our sodium, potassium, which could affect so many functions in our body. It also produces the hormone EPO, which is responsible for making the blood in our body. So there's really so much functions to our kidneys. That's why it's very important for us to take care of them.
Thank you, doctor. See, my next question, you answered so much already there that was partially embedded in my next question, which is how do the kidneys help the body stay healthy or maintain the health? And you answered already so much. Like please jump in and correct me if I'm wrong anytime, if I forgot anything. So of course we know instinctively from the time we're young that the kidneys have something to do with our hydration, or you drink water, you feel like peeing, right? And it's to get rid of like it produces urine, it gets rid of waste in the body. And then when we're a lot younger, we learn simply that it's part of the excretory system, or it's for excretion. But then there's a whole bunch of other things it does. Like you mentioned, it regulates certain hormones as well. And does it also help keep the blood pressure steady? Like it works hand in hand with other
yes,
the circulatory system? Okay.
Yeah, definitely it affects the blood pressures. Actually, kidney diseases are the most common secondary cause for hypertension, especially for patients who starts having hypertension at a very young age. We would always need to rule out kidney diseases as causing the hypertension. So again, it regulates the water in our body. And of course, if we have too much volume also in our body, it produces an extra pressure and additional pressure, causing our blood pressure to be high.
Yes, thank you, doctor. And also, you mentioned the kidneys actually help. I'm not sure if you used regulate, but they release something that produces the EPO, the EPO.
Yes, the blood. Yeah, the
Okay.
EPO.
So it is it responsible, or the kidney solely responsible, or it's part of the system that.
It's
So how
part
does
of the system.
Mhm.
Of course, the EPO stimulates the production of the RBCs, but of course, the production itself happens in your bone marrow.
Mhm.
So, of course, it's part of the process, you know. But luckily now we have EPO injections to compensate for that function of the kidney. That's why most of our dialysis patients who have low hemoglobins will have their injection.
Hello, doctor. Hi, doctor.
During their
Yeah, I think we got just a bit
am I gone?
for a bit. No, you're still here, but correct me if I'm wrong. What I understood is that, of course, it's a process, but the kidneys help. The EPO is actually it affects the production of red blood cells that the bone marrow that happens in the bone marrow, and you say that fortunately today we have the EPO injections. There's EPO alpha, there's EPO beta, whatever the difference is. Maybe if we get into that, we can, discuss that more. For patients who have kidney disease, for it to, or who have kidney disease, for them to be able to produce, they can get the injection so that the function that the kidney cannot do as well as it used to do before, it can replace that function these days for patients who are a bit compromised somehow when it comes to their kidney health. Okay, doctor. So, and you also did mention that when there is high blood pressure in a very young person, that usually the kidneys are checked out to see if it has to do with that. Okay, great. Okay, doctor. Okay, so I know the answer to this, but can someone live? But for our audience out there, can someone live with just one kidney?
Of course, that's why organ donation or kidney donations are allowed, because one person can live with just one kidney, or once you donate or you're just left with one kidney, your remaining kidney will try to compensate for the needs of your body. So definitely one can live with just one kidney.
Okay. The reason I said that I know about this was not because I was bragging, but and even before I was aware of things like transplants and kidney donation, is that my grandmother actually on my maternal side was born with one kidney. So yeah, so so that's why
She was okay, right?
yeah. So that's why I knew. I know this because it has happened. I've seen it. I mean, yeah. So there, but also, as you said, like, that's why kidney donations are very possible, and all that. Oh, I'm waving to my mom. Okay, hi, mom. Yeah, just talked about my mom's mother, so there you go. Okay. Yeah. Hi, mom. Working around while doing the show. But anyway, I'm sure, she'll be happy that I mentioned Mommy Lou. Okay, so, doctor, when we talk about kidney illnesses, how common is CKD or other, or CKD first is chronic kidney disease?
Kidney disease, yes.
So
So Unfortunately, CKD is very common in the Philippines. According to the latest data, around 35 to 36% of Filipinos already have CKD. And this is way beyond the global estimates of around 9 to 13% only. So you would really see how affected the Philippines are with CKD, which again, that's why it's good that we have this kinds of shows, to promote education so that we prevent it from progressing, or we prevent others who don't have CKD yet, right?
Doctor, can I ask you, before, was it this common, or has it gotten, really worse over the last, maybe let's say even 10 years? I mean, and have you noticed more people just suffering from it? Was it something that just wasn't discovered before, or it's really become...
I think it has worsened over the years because as you would see the changes in the census of the top 10 morbidities, constantly CKD has been going up the ranks. Well, it could be one because we have better screening processes, screening process now, or more people are being screened now. It could, that can still be factored in besides having or literally having more cases. But I think it's really increasing because, there are more people who's becoming diabetics, hypertensive at a very young age. Before, you would see diabetics more in the elderly ages, not in the 20 plus, but now we see a lot of patients who are diabetics at their 20s, right? Yeah.
If I were to ask you, what population is most at risk, or if there's a certain demographic for it, how many, how would that hit across ages or gender, or sex or gender? What would the profile of someone who is more vulnerable to getting CKD look like? Because as you said, it's usually it was with, let's say, people who are diabetics when they get older. But now it's even in younger people and all of that. Can you talk about that a bit?
Because the most common cause of CKD is, number one, diabetes, and number two is hypertension. So those are the two major things that would actually put you at risk for CKD. Others would be glomerulonephritis, which is can be hereditary, or it can be secondary again to another process. Family history, of course, could affect it. Intake of some medications that could be nephrotoxic to the kidneys. Smoking could be a risk factor. Obesity can be a risk factor, although again, it's closely related to diabetes as well. So there's definitely different factors that could cause CKD, but definitely the most common ones are hypertension and diabetes.
Okay, so those are the most common ones that cause it. And let's say you have because if, let's say, someone has usually they'll say, okay, some people will say, okay, they have hypertension and diabetes, so they're gonna watch out for their kidneys. But you can also you could have hypertension and not diabetes.
Yes, correct.
And still be at risk for it. Maybe the risk grows in other words.
Yes. Yes, the risk is definitely increased if you have both compared to if you have one. And it's not just having or not having one, but also, of course, the control of the blood sugar.
Okay.
Even if you have diabetes, but your sugars are controlled for example, a 6.5 to 7% HbA1c compared to someone with a 12% HbA1c. Of course, the risks are tremendously different. Between those two subsets of patients.
And doctor, can I ask you what type of diabetes? There's type 1 where you need to inject. Okay, so if you go ahead. Sorry, doctor.
So it's okay. Both diabetes 1 and 2 can actually cause CKD.
Okay, because there's something funky going on with your your sugar and insulin and all of that. It can cause it. Okay, so if you have type 1 diabetes, and actually, because people with type 1 diabetes, what I noticed was that the people I know have it, if they're having they don't get big, they don't get fat, no, and then they have to inject insulin though. And then the people who have type 2, of course, the bigger you are, the more at risk you are for getting it, because your blood sugar becomes harder to control. So anyway, it's like, it doesn't, you can't say I am safe because I have one from that, or oh yeah, okay. Yeah. All right. And also for the hypertension. Now, why does and I'm getting into it a bit, but why does hypertension, and how come both of those things create bigger risk for the kidney getting affected and for getting CKD?
Well, it's because there is increased workload for your kidneys.
Okay.
If you have hypertension and diabetes, your kidneys at initial stages of CKD, it's hyperfiltrating, so it's having extra work. And it's like your muscles. If you're having extra work, your muscles build, right? It grows, it becomes bigger, it hypertrophies. So it's the same thing with your kidney. So overworking your kidney will eventually lead to CKD. It also increases the intraglomerular pressures in your kidney, which can cause further damage, oxidative stress. There are different ways it could actually affect your kidney. So again, that's why controlling these factors would definitely be able to prevent the progression of your CKD.
Okay. Thank you, doctor. Now, doctor, when it comes to younger adults, or the younger population, no, you mentioned that a whole bunch of people in their 20s already have CKD.
Yes.
What do you think there are causes that you can attribute to the increase of younger adults getting CKD? Do you see anything in the studies, or just, what the medical community in general feels or thinks at this point is really causing the rise in the cases of younger adults who have CKD?
I think number one here is our diet.
Okay.
Especially Filipino diet. It's very high in carbohydrates. Actually, we don't high carbohydrates, high fatty content, because our food is really good, so so we really tend to have metabolic syndromes, which includes diabetes. And I guess I think it starts there.
Okay.
Yeah.
And okay, so starting with the diets that Filipinos have, are carbohydrates like really, really bad, or is it because that then leads to like diabetes, or like not enough? I guess sugar is worked off, because there's also, I think, when you have CKD, you're asked to watch your protein. Like, how does that come into play in terms of your diet?
You know what I always tell my patients, eat everything in moderation. Anything too much or too little is actually not good. Not just because you're a vegetarian means that you're healthy. There are a lot of nutrients that you don't get in vegetables, but you can get in meat, and vice versa. So again, everything in moderation. So when people ask me regarding diet, that's what I would say. But generally, of course, if you have diabetes, it's low carbohydrate diet, but again, there are foods with high glycemic index and low glycemic index. There are different types of carbohydrates out there. Some people would say, oh, I don't even know why I'm not losing weight.
Yeah.
I'm not even eating rice, right? But people tend to eat pandesal or bread or pasta instead of rice. But they don't realize that rice is a simple sugar compared to your breads and pastas, which have, different types of sugars. There's starch, there's yeast, there's different ingredients that is used to make that, and it makes it harder for the body to actually metabolize the sugar. The same way with proteins, I know that most patients, we actually advocate a low protein diet for patients with CKD when they are above CKD 3 and above. But generally, we ask our patients to, not low, well, to restrict their protein in a way that it's around 0.8 grams protein per kilogram per day. So again, it's not that you cannot eat it. You just have to eat it in moderation. So I would always tell my patients also that they could actually download the applications, or different applications now on your phones, that you could actually put in all the food that you eat, so that you'll have a rough idea of how much carbohydrates, proteins that you have been eating. And at least that will give you a general idea of how much you can eat in a day.
Okay. And at least that's one good thing that the apps bring.
Yeah. I mean, we have this technology now, so we might as well, put it into a good advantage for us to stay healthy and live longer.
Yes. Yeah. Okay. So doctor, we just need to take a short break, but when we get back, folks, I'm going to ask doctor about the signs and symptoms that you may have a kidney problem. Like, what do you first start seeing, or how do you first start feeling? And then we'll take it from there. So stay tuned to Healthline with Makati Med. We'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders. You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Welcome back to Healthline with Makati Med. I'm here with Dr. 𝗂𝗶𝘁𝗵𝗏. She is a nephrology specialist from Makati Medical Center. Okay, so doctor, we're discussing the kidneys, how to keep them. Well, first we were talking about what damages them, and then maybe we can, spend a bit of time later on. Maybe you can tell us how to keep them healthier. We can sort of veer towards that. But in telling us how they can get damaged, you're also already telling us how how to keep them healthier. So thanks for the information you've discussed so far. You've given us the function of the kidneys and how they help in so many other, systems in the body, including producing red blood cells. And many people don't realize that. And, I did not realize that till, I guess recently, but thank you for, coming on the program. And I just really want this to be an informative platform for those who, first of all, to prevent kidney disease, and then to get themselves checked out with a specialist like you and with a doctor as smart as you, as sharp as you. Before the show, she was already treating me. Thank you, doctor. Giving me advice on how to get treated about one small thing. That's the kind of doctor I love. And then also, you gave us all these really straightforward and clear answers. So can I ask you, what are the early signs and symptoms that you may have a kidney problem that you may just take for granted and sort of ignore for a while?
Unfortunately, CKD doesn't really have symptoms until it is very late.
Okay.
That's why screening is very important in terms of CKD.
Yeah.
But definitely once you're at the latter spectrum of the CKD, you'll feel tired. Some patients will have some epigastric pain, some bleeding in worst cases. Some patients would be difficult to wake up, because they're too drowsy. It happens. They have metallic taste, so they have poor appetites. They might lose some weight. So if you would see, the symptoms are very general. It's not very specific to the kidney. So that's why I guess it's why we don't get to check the kidneys specifically because the symptoms are not so specific about it. And like, for example, if you have chest pains, you know it's your heart, for example, right? So the kidneys are not like that. Once you have symptoms, it's the latter stages already. So there.
Yeah, okay. So it's best to screen. And
Yeah.
I mean, a lot of, not a lot, but a bunch of people I know, and including myself, are just, I don't have it, but I know some people who have been diagnosed with it, and it's just like you're just kicking yourself, thinking of who shouldn't, I should have caught that,
Yeah.
I missed it, and it's I guess in a way it's not really comforting, but at least you're telling us that, see, that's why you have to like really screen, especially I guess if someone has either hypertension or is getting up in age, or has diabetes, or has both, and all the other, or in yourself that your diet is not that great, and you've been saying,
Yeah.
years I'm going to drink more water, but you keep drinking soda or whatever it is, because as you said, unfortunately, when the symptoms, the very like visible symptoms start appearing, you already are somewhere in the spectrum of the disease of CKD. For, is it
Yeah.
stage 1 to 5? No, okay.
Yes, correct.
Yeah, okay. I'll try not to look sad for the audience, but it's really bothering me. I just, so for anyone who's suffering from CKD out there, I really, really feel for you. And I'm sure doctors like Dr. Padua, feel for you more. So please do get checked out. Now, when we talk about screening and all of that, doctor, how do you get screened for CKD, and how often should it be done? Now, let's just start with perhaps you can tell us just like the basic screening, and then like after that, since we said there's a population of people who are like it runs the gamut from older to younger. They would be saying, I'm too young to do
Yes.
that, or I've reached this age without any problems. I don't want to do it. I don't want to know, right? I mean, so can you tell us first? Okay.
Well, it's good because, the younger population, they usually go to works. They work for companies which do annual physical exams, and, that usually includes a urine analysis.
Yes.
So in urine analysis, we check for proteinuria. If the presence of proteins in the urine, that even if you have a normal creatinine, but you have a lot of protein in the urinalysis, it can still be labeled as a CKD, because there is still a damage to the kidney that's causing the proteins to be filtered by the kidney, right?
All right. So
so besides that, of course, your creatinines, your BUNs, we could also do abdominal ultrasounds to check for the size of the kidney. Usually the kidneys shrink or become smaller in CKD, except for certain types, such as diabetes, wherein the kidneys remain the same or a little bit bigger. So, but at least it gives us an idea how long, or has the kidney disease been chronically happening, or is it an acute cause of the increase in creatinine? So of course we always correlate all the laboratories with the clinical aspect of the patient. It's not really just checking one laboratory, but checking the trends, checking the history, the physical examination of your patient. So it's not a one size fits all na normal creatinine, no CKD. It's not that way. That's why it's very important for you to see your doctors. It doesn't necessarily have to be a nephrologist at first, but to help you or to guide you or to individualize your screening tests for your comorbidities, for your family histories, your diet, your occupation, that would put you at risk to certain diseases, and so that the doctors will be able to help you and guide you as to what you would need to do. Yeah.
Well, okay. So thank you, doctor. It's definitely like getting the whole picture. Also, like you said, so the clinical examination will you also being interviewing the patient, checking them out, or another doctor doing so and saying, I think you need to see a nephrologist, right? And there's the urinalysis. It does start with that. And then the blood test. And for the kidney, the blood test for the kidneys, you don't need to fast, right? You can,
No.
yeah, you don't need to fast. And then there is, you check the creatinine, the BUN. And then also, can you tell us about the EGFR? And if that's completely reliable and in what sort of scenarios?
All right. So EGFR is estimated. So by that word in itself, it's just an estimation, right? So it would fluctuate up and down according to your creatinine level. So it's just a modified formula. But if you want to be more specific or not, the gold standard, it's quite tedious to do. You would need to collect your urine for 24 hours. Those would be estimating our GFRs more accurately. But again, it's tedious to do. So we make do with EGFRs, which we calculate using your gender, your the patient's age, and the creatinine at that specific point of time. At that specific point of time. So, but at least it's a rough guide as to where you are in the spectrum of the CKD.
Okay. So getting the EGFR does help, but of course it comes down to a nephrologist like yourself to really say, we should do this, or we should do the test that you mentioned where you take your urine for a period of 24 hours so that we really know, and then you also you collate the data coming from the urinalysis, maybe how the patient feels or the symptoms, their diet, everything, other things that may be going on, maybe other illnesses already caused by this, and then you can be more specific in like telling us, okay, you need to, not naman na you need to be worried, but we can help you this way, or you're probably in this.
Yes.
Because I've seen sometimes where the EGFR will say something, and then I was like, okay, so, and then the next time they take it, it's higher. The kidney function is actually higher. So as you said, it does also depend on the creatinine level at the time. So that helps us understand it a lot. And also not, I notice in talking to nephrologists, sometimes we panic so much. But of course, it's something we really take seriously. But at least you can allay some of our fears when you say that, we can still stabilize this, or there's still something we can do about this. And also, this is how we can proceed or should proceed with treatment. And doctor, when we talk about treatment, how do you usually treat someone with CKD or kidney issues in general? Oh, sorry. Well, I want to say earlier that, of course, your interview of the patient is important, because you mentioned it's either CKD, chronic kidney disease, or acute, an acute kidney injury. Because, of course, if you're talking to a doctor and then everything's normal and suddenly, this went up and this part of my back hurts where the kidneys are located, then you ask them, well, what happened? And you're like, some car bumped into my back, or someone kicked me in the back. Well, then that could be, that's why you have an acute injury at the moment. Okay. So anyway, doctor, I appreciate those things that you say to differentiate. But when it comes to treatment, how do you usually proceed?
Okay. All right. Since we segue to that, I would always ask my patients how long or what was their creatinine prior to the first time that I meet them. Because again, if it's acute kidney injury, it's less than 3 months. And when it's CKD, it's more than 3 months. No? So when it's an AKI or acute kidney injury, their treatment goals is to put it back to baseline, back to normal. While if it's a CKD, our goals of treatment is to delay the progression of the creatinine to go up, So, for example, our patient has already more than 3 months, creatinine has been up. So there are different ways to help delay the progression. Again, one, the diet and exercise. That's always number one. Number two, control your blood pressures, your sugars. Three, avoid or stop smoking. Four, avoid nephrotoxic medications, meaning, for example, pain medications, the most or the safest pain medications would be your paracetamols and tramadols, the ibuprofens, the diclofenacs, those NSAIDs are actually harmful for your kidneys, especially when you are dehydrated, when you're drinking it. It could actually affect your kidneys more, or when you're chronically taking those pain medications. Those are some of the things that we would actually educate our patients on. And we're actually also very fortunate at this time of age. We have different medications already that we could start our patients in. For example, SGLT2 inhibitors, which were originally given for patients with diabetics, but now, even if you don't have diabetes, we could actually still give SGLT2 inhibitors to help or delay the progression of your kidney problems. But again, of course, you would need to see your nephrologist before initiating these medications, because, again, the treatment should be individualized. Yeah.
Okay, I'm definitely gonna get your number after the show. And since I passed you in front of the whole world, you cannot say no.
Okay. Yes. Okay, no problem.
So the things you've mentioned, no? You mentioned NSAID. So those are non-steroidal anti-inflammatory drugs. And I have something personal against NSAIDs already at this point.
It's okay.
But really, because they can cause stomach bleeding. And I mean, it's just that we had gotten used to maybe 30 or more years ago na it was on the market, to just keep taking them, for anything, a backache, a fever. And a lot of people still do, especially also in the Philippines. You just take
it's easy to buy it.
Yeah. I mean, and also, syempre, you're in pain, but you're not warned of the dangers, and people do abuse it because I'm like, you're taking that every day. Maybe, you should go see a doctor about that pain. And, okay, for example, so let me just compare it to acetaminophen in the US. It's really sold here, but it's similar to paracetamol, which is sold here under various brand names. Those are not harmful to the kidney, but of course they say don't take it every day because it's the liver naman that it kind of...
Yes. Because your paracetamols are actually metabolized by your liver. So it's really more of a liver injury rather than a kidney injury. But of course, again, there are recommended dosing.
Yes.
So you just don't go overboard the recommended doses. That's why there's a reason why it's 500 milligrams every 4 hours, right, for fever. It's because that is what we know that is still safe, both for the liver and for your body in general, right? So in terms of patients who take NSAIDs chronically, I would really advise them, you could take it for a few days only, and as much as possible, you have to keep yourself well hydrated when drinking these medications. So whenever I personally prescribe my patients NSAIDs, in my instructions, you have to drink a glass of water with it.
That's great, doctor.
And then the same way, if we think that the patient is going to drink it chronically, there are other alternatives, such as, for example, your ketoprofen gel, or warm compress or cold compress, something topical that would have less systemic absorption, that could still help our patient's pain be alleviated compared to just drinking with medications.
And then you start drinking with like chronic pain, ice drinking. What am I saying? You start treating like with different methods of chronic pain management if or it's the kind of thing that an injury that really hurts the person. I mean, you could have a totally different type of injury, and then you've been taking over the counter meds to to help you with that, or even someone as healthy as an athlete, let's say, then they get masay so bam, and NSAID here, bam, NSAID there, NSAID every day, and then apparently they're injuring their kidneys already without knowing it. So you mentioned tramadol. That is a painkiller, yes?
Yes.
Is that an opioid? No.
I think it is. But it's lower in the rank with morphine. Definitely lower, because I think there's like a tier for that. So it is, but the low dose or the initial part.
It's an opioid, but it's probably not considered a narcotic.
That's why I can just buy it over the counter, and you don't need a special prescription for that.
Sometimes as a patient and people who people that I know, I get frustrated because there are some people who cannot take things that are non-narcotic, and then so we talk about addiction. Now we don't want so but they're opioids, but we talk about addiction. It's so difficult though for people to get medication even if a doctor prescribes it, and then so they resort to taking NSAIDs all the time just to get over the pain and the hassle, and certain drugstore chains acting like they're the PDEA or drug enforcement agency, and you're like, there's a freaking reseta for it, and it's like, it's just frustrating when it's not done properly, and that's also part of the reason that I've seen people popping NSAIDs.
Yes.
You've been taking that for years, every day. You better have your kidneys checked. Like, you better have your stomach checked. You might have some bleeding, and then they're like, really? I'm like, well, no, don't panic, but just have it checked anyway. So I just wanted to bring that up as, perhaps part of the larger picture. And doctor, so there's a question always when it comes to kidney health. How much water should we be drinking?
I would also tell my patients to drink according to your thirst.
Okay.
God has made us to feel thirsty if our bodies need water, right? So, of course, it's already taken that every meal you would drink a glass of water or a glass or two of water. But it's not advisable for you to keep drinking water even if you feel like vomiting already, or like you can't take it anymore. But no, I still have those big jogs with 8 a.m., 10 a.m., and then you really can't already. Your stomach is already so full, but you still keep trying drinking. That's one thing that I don't advocate for, because people don't realize that too much water can also cause some problems. It can cause your sodium to go down. When your sodium goes down, you'll have headaches, dizziness, and worst cases, seizures, comatose. So again, let's go back to what I said earlier, everything in moderation. And the same thing goes with water intake.
Okay. All right.
Of course, I just want to clarify. Of course, there are certain exceptions to that. For example, if you have kidney stones or nephrolithiasis, then studies have shown that you need at least 3 to 4 liters of water per day. So that one I would be specifically telling the patient, you need to drink this amount of water. But otherwise, drink according to your thirst. You don't need to do water therapy per se.
But I just laughed at the idea of if you feel like throwing up, because that happens. No, sometimes somebody's dizzy, or they're like, I actually heat exhaustion, let's say, or heat stroke, then they drink water. I'm already throwing up. I feel like throwing up. forcing me to drink water or something like that. Okay. So all right. Of course, when it comes to water, okay, we have to talk about other drinks here also.
Mhm.
First, when you say, okay, drink according to your thirst, some people will drink let's say water, coffee, soda, anything else, even milk, whatever it is. That's not exactly water, but I mean, it's a liquid. It has some water in it. Do you think that if okay, I've heard wise guys say, well, I drink like 6 glasses of, okay, I almost said the brand name of this certain soda or whatever, or a certain tea a day, so that's enough. What do you think about that? What's your opinion on that?
Again, everything in moderation. So it's not that you can't drink soda or they can't drink alcohol. But again, everything in moderation.
Just a good mix.
More than kidney disease, I feel like it's more of, for example, if it's energy drinks or soda, it's more of diabetes. And again, diabetes can lead to CKD. So everything are connected to one another. So you really have to
You're kind of
balance.
you have to balance everything, and you're sort of risking it. Okay, you mentioned energy drinks, so let's talk about that first. With energy drinks, sometimes it feels like it quenches your thirst more. And if you drink energy drinks and you're not actually doing sports or sweating it out a lot, like what are the dangers in that? Like let's say you look at the ingredients and there's not so much sugar. Oh, what are the other ingredients that are usually in there? Although a lot of the energy drinks here have a huge amounts of soda and caffeine. Like you take one and you're like, you start to feel like I drank a whole like pitcher of coffee. And then you're like, oh my God. So like what can you tell us about energy drinks that, the truth behind them, like in terms of how it can affect not only your kidney, but what's really in them? Because we just think, oh, energy drink, we can do that. Or I'd rather drink 3 energy drinks than 1 cup of coffee. Can you tell us?
Actually, I'm not particularly sure about what specific ingredient, but definitely there is caffeine.
Okay.
So the caffeine won't directly affect the kidney. I think it's more, for example, your heart. It will affect your heart. You'll have palpitations. Those palpitations, if it's chronic, there are some patients I had some patients who had their what we call hypertrophy of the heart caused by chronic palpitations. And the risk factors that we have for that specific patient is that patient has been drinking energy drinks because he's a call center agent.
Yeah.
He drinks around 4 bottles, 3 bottles of energy drinks every duty. And that took a toll on his heart.
Yeah. Okay. Yeah. Beat that amount, by the way, long time ago. But it wasn't, I mean, after not good. What is it made of again? I was like, oh, okay. Because, and then
it's a lot of sugar.
And it was like, oh, because it tastes so good. Because it came with an alcoholic drink. So I won't say what it is. I'm sure all of you already know. But I'm like, I'm not really getting tipsy at all, and like I'm just up, And then I'm like, oh, okay, no wonder. Realize the ingredient. Okay, but okay. So anyway, there's that, and then there's people who drink it to stay up. I understand that because there are times when I really need a caffeine boost or sugar or something to stay up, and a lot of the work that we encounter is sedentary and not and even if you do physical work, like you work outside or you do construction or painting for a job, you get tired, and then there's so many deadlines that you have to meet. So with those things available, you tend to just scoop them up and take them, And, well, it helps my body function. It helps me function. So, I guess that's a warning too. Like, we can only do so much to push our own individual bodies without risking hurting it even more. How about these detox drinks that we hear about, and herbal blah 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 and herbal this? Because I don't trust some of them. Unless you want to advertise, but
No, not.
really, not you not doing at first, but no, honestly, like, I don't trust some of them because I'm like, that thing seems to like have, can you tell us a little bit more about them from your point of view?
Well, if you would see the box, it would say no approved therapeutic claims because it's not proven to do anything, So I would always tell my patients, if it's an herbal tea, herbal supplement that you prepare yourself, that can be okay. But if you buy it from outside, you don't know how, even if, for example, it's barley, for example, it's healthy. We know barley is healthy, but for them to be able to manufacture the barley into a powder form or into a capsule form, what ingredients did they include? That one I would not be able to answer. So again, I would tell them that it would be better if they would prepare it themselves if they want it really fresh and healthy, But at the same time, you can't overdo it as well. Again, fruits, vegetables for your detox drinks, eventually it can cause diabetes if you drink it too often. Or if it's a type of detox drink wherein you'll always go to the bathroom, you might be too dehydrated, because of all the excretion that you have been doing, and dehydration consequently can also affect kidneys, and some other organs in your body. The same way as many of the vegetables and fruits have high oxalates, and oxalates can cause the formation or initiate the formation of your kidney stones. So again, the same thing, we go back again, everything in moderation. You don't have to drink it every day. Just everything in moderation.
Okay, thanks, doctor. And I've also heard of treatments where, you drink this and you drink that and you take it. Maybe if it's a 2-day thing and you're healthy enough, there are kind of flushes or something.
Yeah.
Works, but I was offered a few times. I said I'm not gonna do it because I don't know. I really don't know, and I don't want to be like stuck in the bathroom. Then I end up in the hospital because you flushed me out too much. And also if you're not so sure, consult your doctor first. I mean, I suppose you could do it if you consulted your doctor and you divulged everything also that you have or that you're concerned about when it comes to your health and maybe being affected by different things. Because, sometimes even if you say it's natural, it doesn't mean that too much of that natural substance is good for you. You mentioned like if you keep I'm just going to eat fruits every day. There's also fructose, there's sugar in fruit. So, it can bring up your sugar too. And then you'll be wondering, why is my sugar up? Or, and I eat fruits every day and just fruits. So as you said again, you put it perfectly in the beginning, everything in moderation. Unless I guess you grew up just eating fruits and then it works for you. But consult your doctor anyway. Right? I mean, I don't want to say like something like that. And then somebody goes, oh, well, I grew up just eating fruits and, we're watching you from my fruit farm. So we'll just continue. Okay, doctor. So we've talked about, diet in terms of that, activities. What if you mentioned diet and exercise are the number one thing when it comes also to kidney health as well as other, with so many things it's that. But what if you're older or you have an injury or you have other conditions where you cannot move around as much? Or,
well, it depends. It definitely depends with what kind of injury you're dealing with or how elderly is that patient. Well, one, we advocate for moderate intensity exercises. So if kunyari, the patient has osteoarthritis, bad knees, we would say, oh, swimming would be a good option, because in swimming you eliminate your weight, right? So it will be able to help with patients with osteoarthritis. Or for example, if the patient has bad heart, for example, in the hospitals we have our rehab centers, wherein they will be able to curate specific progressive exercise regimen for that specific patient. If the patient is bed bound, for example, they'll do passive exercises first, and then if the patient is able to tolerate that, they can progress to dangling legs in the bed, standing up, to transfer to a different chair from the bed. Again, it's a progression. We don't have to go, do something
that's too
big right away. Again, it's there is always we individualize it. So the same way, it would depend on the patient on what type of exercise would best fit that patient.
Doctor, who would someone go to, and let's say in Makati Med, to find the right people who can give them the kind of exercise or physical therapy or whatever you call it, for their condition, whether they're older, whether they have bad knees, whether they have other medications that make them sleepy, or, just different conditions?
Well, we're talking about adults, right? So, so they could actually go to any internist. All internists would know, like, at least the brief general things about the adult body, right? And then if the internist thinks that this patient needs help with rehabilitation, then that doctor will be able to refer to a rehab specialist. So we have another set of doctors who actually specialize with rehabilitation. So it's a medical team. Everyone works hand in hand. So that would the rehab specialist will come into play in this specific instance. And the same way, we have dietitians, we have nutritionists. So if the internist's not able to do it themselves, they could always tap the help of the other allied health to give an overall care for our patient.
Yes, like it'll all be together, the diet, the exercise, and also like you're telling you that this is okay, it's enough, because sometimes from our younger years or from the people surrounding us, we get guilty feelings like, "Just, I didn't do enough," or, I'm not doing that much. Or sometimes, and then there's also probably, I wonder if there's therapy for tamaditis.
Kulang lang sa motivation.
Pero dapat tama yung motivation kasi, it can backfire if you're nagging, diba? Parang, okay.
Yeah.
Okay. Anyway, that was just to lighten things up. And, I know people who get called like, no, kasi you don't want to do it or you're lazy. But they actually have conditions where it's difficult for them to exercise as much as they're expected to. So thank you for giving us that information and for talking about that. And so, doctor, as we are, ending our time for our time for today is running out. Can you tell us what your major pieces of advice are for those who have kidney illnesses, or even just to protect our kidneys? Like, go for it, doctor. Let loose.
Okay. All right. Like the ways to prevent CKD would be everything that we have talked about tonight. Number one, diet and exercise. Eat everything in moderation. If there is something that you feel or you know it's not normal, it would be better to consult your doctors already so that they'll be able to advise what tests or treatment you would be needing. Don't let it go worsen first before seeing the help or seeking the help of your doctors. Three, don't take anything that's not prescribed or proven. In this day of age, there's so much reviews that you could read. Google will be there. Even Google will say no approved therapeutic claims for certain things. So don't always believe what you see in the internet or in the advertising in TV. You should always do your due diligence to research or to ask your doctor friends or anyone in the health profession to avoid complications in the future. But again, when all else fails, it's always you would always need to go back to the basics of eating well, eating healthy, keeping your body strong, to fight all this diseases and infections that that can complicate things.
And also, doctor, to add to what you said, apart from the ads and all these things that you will see, it says there, no therapeutic claims. There's also like advice from a lot of people. They're well-meaning, but even yung like with us Filipinos, yung kumain ka ng maraming, let's say, kumain ka ng maraming eat a lot of bananas and then your kidney will be fine. Actually, that might be bad because your potassium will go up. Yeah. I remember talking to one person who their potassium was up and then their kidney, and I said, what do you eat every day? And I was, of course, being like a meddler, right? But they were asking, so, okay, let's take out the bananas and the potatoes and stuff for a while. And then if it goes down, ask your doctor. So it went down. So now they just watch that banana and potassium thing because apparently may a lot of bananas, potassium, even some vegetables are in that. So be careful also of those things. Yes, bananas are healthy and some people need potassium, but you might be getting too much of it. And I'm not against potassium. I need it, in fact. Okay. So anyway,
everything in moderation.
Yeah, everything in moderation. When people need to go for kidney screening or where can they go? How can they do that? Can they call you directly? I mean, what's the best way to do that? And should they take a blood test first? Like, what should they do?
There are, of course, if the patients have HMOs, they usually need the doctor's prescription or test requests first, but if some patients are private patients, it would be good if they'll be able to do we have like Magic 12, Spec 23, like the complete battery of tests. If they're able to do that and then see a doctor, that would be good also. At least it will save time from going back and forth, at least because this battery tests are almost complete, and there would be fewer tests that probably we may be requesting depending on the results of that battery tests.
Yeah.
So yeah.
Sometimes I add more to them. Like,
yeah.
Then you should get
Yeah.
But of course, you don't have to do that. It's just people who come
Yes.
check that because and. Anyway, thank you very much, doctor, for being on the program today. But before I let you go, is there anything you'd like to say, any advice? I would first like to, especially for those who have kidney disease or, CKD or anything related to kidney illnesses, is there any advice you'd like to give or any words you have for them and their relatives, to care for them?
I would just say that although kidney diseases or CKD is a forever thing, but it doesn't necessarily lead to dialysis.
Okay.
So there is nothing that you should be scared of in going to your nephrologist, because like what I recently said, I would measure my success not with how many patients I dialyze, but the number of patients I save from dialysis. And that would only be possible for me if our patients would go to us at a certain, in the early stages wherein management will be effective enough to delay the progression that they wouldn't need dialysis in the future. So seek your doctors as early as possible at the onset or at the first sign of any kidney problems.
Okay. Thank you, doctor. I will be doing that and getting your number after, not for me, but for someone else, but maybe, who knows? I'll check it out. And doctor, would you like to say hi to anyone before we go?
Hi, everyone.
Okay, hi, everyone.
Alright.
Okay. Okay, so I want to say hi again to my mom, and hello to Oma Alberto, who watches the show all the time. Thank you for your support. Hello to Tata Lita Alcantara. I love you, Tata. Okay. So thank you, doctor, for being on the show, and please come back again soon to talk about more things we have to
Time.
do. I'm sure we can do deep dives into some topics, and just your things you're mentioning about nutrition and how the kidney functions. These are really not just interesting, but important to know, because I think the more you know about these things, the more your awareness is raised. And it's not to make you a hypochondriac, it's just to be able to uplift your lifestyle and the lifestyle of those that you care about. So thank you for being on the show today, doctor. Folks, this is Healthline with Makati Med. I'm Nicole Jacinto, your host, and we were here with Dr. 𝗂𝗶𝘁𝗵 today. So we'll see you again next week. Bye now.
Thank you. Bye-bye. Thank you.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.